I was nervous about tearing something down there because of the episiotomy. I didn't know what that looked like or what the recovery process was, so I was scared even after I was in the clear after my exam at 6 weeks that something would go wrong and I would start bleeding.
Re-injure yourself.
Yes.
So that's a total myth that having a cesarean will save your vagina. That's not always true.
Yes, that is no, not true.
It took a long time, which was really disappointing because I wanted to be exercising sooner, but it wasn't until probably close to a year that I felt like I could really start getting back into a regular exercise routine.
Yeah. I know as someone who works with moms all the time, there's nothing worse than having them ask you a question or coming to you with something that is just devastating them that you don't have an answer to. Unfortunately, we just can't be the expert in everything. When someone comes to me with their concerns about postpartum depression, I know the red flags, but I don't know how to treat that, and so I refer them to someone that specializes in that sort of thing. Incontinence, painful sex, returning to exercise, having happy, easy bowel movements, those are in my wheelhouse as a physical therapist. And I want to share this program that I've created with your clients and with you so that you can spread the word that we don't have to feel damaged, we don't have to feel broken. There is hope for new moms after childbirth, even for childbirth that didn't go exactly as planned. I want to thank you for sharing this program with your clients. I know they mean the world to you, and I know that you wouldn't give them anything that you didn't wholeheartedly believe in. So here's a sneak peek look at some of the things that your clients will learn when they participate in this program. There are actually two types of incontinence that are pretty common after having babies. One is stress urinary incontinence, and the other is urge urinary incontinence.
So if you're curious if you have a diastasis recti abdominis or a DRA, this is a position that you want to check for it in. What you want to do is go to your belly button, go about 2 inches above your belly button, place your fingers at the midline, and lift your head up off of the table until your shoulder blade clears the table.
Something else you want to be looking out for while you're working out is doming or coning of your abdomen. Okay, so now is the time to think about those exercises that you really want to get back to. You've addressed those 7 things I talked about earlier. You know you have some pelvic floor weakness, so you're working on that. You've worked on your breath work and your core muscles, and now it's time to get back to your regular workout. I love nothing more than we can come together as a healthcare team and provide the absolute best care and results for our clients.